that is computerized physician or
Dr. Vijay, you're good to go. Vijay sir, you're good to go.
Yes, sir. Thank you. Hello, everyone, and welcome to today's webinar on clinical decision support system, a paradigm shift in in health. I'm Dr. Vijay Kautilya, professor and head of forensic medicine at Sri Sathya Sai Medical College, a constituent unit of Sri Balaji Vidyapeeth, and I'll be your moderator today. Today's webinar is ninth in the series of our webinars organized as a part of our SBV Connect, an initiative from the desk of the Honorable Vice Chancellor of Sri Balaji Vidyapeeth, which provides a platform for eminent and renowned speakers of medical education and patient care to come together and share their experience. If you are attending for the first time, let me tell you, you can join us on all third Wednesdays of every month and be a part of our SBV Connect. I'd like to first extend a warm welcome to our esteemed speakers of today, Lieutenant General Dr. M.D. Venkatesh, Honorable Vice Chancellor of MAHE, Professor Amit Banerjee, sir, Honorable Pro Chancellor of Shiksha Anusandhan, and our very own Honorable Vice Chancellor, sir, Dr. Subhash Chandra Parija, sir. Thank you all for taking time out of your busy schedules to be part of this event today. Participants, please note, during the process of our seminars or the webinars, you will be kept on mute. And if you need to share anything or if you have any queries to ask, the chat box is open and please do post your queries on the chat and we'll get back to you at the end of the sessions to discuss the chats. Clinical decision support system, a paradigm shift in health. When we talk of clinical decisions, most of the time, what we realize is clinicians are very passionate about their decisions and they like to own them. They most of the time demand their decisions emotionally and also academically. And if you are listening to this term for the first time, I'm sure you would be wondering why would an efficient clinician require support in clinical decisions? So considering this, clinical decisions basically are based on critical evaluation of what is available knowledge and the evidence on the facts. And as you all might agree, lifelong learning is an efficient quality or a competency for all medical educationalists and also for clinicians. Reason being, both these terminologies, knowledge and evidence, are something which are very active, dynamic, and constantly evolving. And it is very difficult for one person to be in touch with all changes that are happening in medical care. So it would always be ideal to be assisted by a process or a system that can help us or channel our critical decision making process so that as clinicians and as physicians, we can reach an appropriate decision when required. So here comes what is clinical decision support system. It basically tries to link health observations with health knowledge so as to influence health choices by the clinicians to improve their healthcare. Now, most of these modern systems of clinical decision support are based on active knowledge-based systems that keep evolving and that keep track of new knowledge. And they also utilize a lot of artificial intelligence. Now, the best two models which I would have come across is maybe one which is quite successfully running is something to do with Poison Information Center. It's a WHO certified poison information. But basically, these centers are specialized units which basically tend to advise clinicians on matters of toxicology so as to help or guide them to take appropriate preventive, diagnostic, and management decisions. Most of these utilize specified softwares, like for example, WHO Poison Information Center has something called as Intox, which is akin to one of the clinical decision support systems. So this is quite a successful model. And further to consider, if you consider the current scenario of COVID-19 that we are having, there is a huge amount of data that has been created, and it is very difficult for one person to be oriented to all these in one single point of time when it is actively changing. All this brings us to what is clinical decision support system. And to learn about this topic, so we have 3 sessions lined up for you today. So we will first begin with what is the relevance of CDSS in patient safety. We will go on to learn about what are the different roles of CDSS in clinical management and diagnosis. And then we will also learn about what are the challenges that we can face in implementation of CDSS. So let's begin the first session for today on relevance of CDSS in patient safety. I'd like to first introduce our honorable speaker for the first session, Lieutenant General Dr. M.D. Venkatesh. He is the Vice Chancellor for Manipal Academy of Health Education. Professor Venkatesh sir is graduated from the prestigious Mysore Medical College in 1997 with an exceptional academic record. And he was commissioned to Armed Forces Armed Medical Corps in 1979. He is an exceptional ENT surgeon who is trained in cochlear implants and also neurotology, and he's got his MS degree from Mumbai University. He has contributed significantly in the field of medical education, having trained generations of undergraduates and postgraduate students in Armed Forces Medical College, Pune. He is the founder of the medical education department at AFMC, and he was instrumental in online admission process for the UG and PG and postdoctoral admissions in Armed Forces Medical College at AFMC. Dr. Venkatesh has also joined as a Vice Chancellor of Sikkim Manipal University and served as 3 years there. He has displayed inspiring leadership qualities, team building skills, and has made Team SMU a confident, cohesive, and result-oriented unit. Under his leadership, SMU achieved recognition as a leading private university in the country. Sir, we extend a warm welcome to you. Over to you, Venkatesh sir. Can we request you to please share your slides?
Thank you very much. Yeah, is my screen seen? Am I audible, please?
Yes, sir, you are very clear, and the screen is also visible.
Yeah. At the outset, I thank Honorable Vice Chancellor of Sri Balaji Vidyapeeth, Dr. Parija, for inviting me to this webinar. And I extend warm greetings from Manipal Academy of Higher Education, institution of eminence deemed to be university, to all the faculty, students, and all the attendees of this workshop, faculty, students, and the other members of Sri Bharati Vidyapeeth, University. and to all the attendees, very, very warm greetings to you. I'm very, very happy to see that the SBV University has taken up during this pandemic, events to bring in new knowledge, disseminate knowledge, and popularize the newer technologies in medical education and healthcare to the needy physicians and to the students by holding these webinars on every Wednesdays. And I am very happy to be part of this webinar today and to be speaking on relevance of clinical decision support system in enhancing patient safety. As already mentioned by the moderator, the clinical decision support system is a new paradigm, a new entity which has come into the realms of medical practice. And it definitely is making waves in terms of providing right information at the right time for the right decision-making process towards carrying out healthcare-related activities in any healthcare system. And I would be making a presentation in the following workflow, giving you an overview on patient safety and decision support systems, functioning of clinical decision support system, this decision support system in clinical care and patient safety, some important aspects of patient safety goals, and also highlighting the relevance of clinical decision support system in achieving patient safety goals. To clearly define what a decision support system means is it's an interactive computer system that is essentially accessible to and operated by non-computer specialists to assist them in planning and decision-making functions. This has been adapted for healthcare system and it has now become clinical decision support system. The decision support system provides the managers or the administrators the ability to receive condensed and analyze information that enhances their job performance and efficiency. So how does it work? It works through a huge amount of digital data help, and it's based on its functioning through integrating huge amount of data, knowledge bank, processing it through appropriate tools, that is the software, which is able to translate scattered data into meaningful data, based on which it can help clinicians make patient care decisions, avoid errors, and also help identify potential problems by identifying the root causes. Decision support system also helps to avoid errors by providing alerts and thus helps the healthcare team to be able to perform their functions most effectively and efficiently. Now, a decision support system includes any health system workflow or a process which is intended to deliver.
Venkatesh, sir,
Right.
sorry,
Yes.
can I interrupt for a second? So can we shift to the slide share mode? Your slides are not changing. Can we shift the view to the presentation mode maybe?
One second, just one second. Should I stop and start all over again?
Yes, sir. We only have the first slide visible, and I think the participants are not able to see the change in the.
Okay. One sec. Well, let me close this and then I will restart again. Huh?
Welcome, sir.
Is it all right now?
So we still have the same first slide.
Just one second. Sorry for the technical glitch. I'm sorry, there's some technical error out here. One sec, give me a sec. Just one. Am I audible, please?
Very clear, sir. You are audible clearly.
Yeah. Just one sec. Sam, they're unable to see the change slides. Can you help me? Put it on full screen and then share. Is it seen now?
No, sir. Can you please share the screen, sir?
No, sir. It's not shared yet.
Host கொடுங்க. Host கொடுத்துருக்கா.
Is it seen?
Yes, sir. Please make it as a presentation mode, sir. Full screen mode.
Full screen.
Full screen mode. First do full screen before share it now. I'm sorry for this technical glitch. Is it visible now? Hello?
Yes, sir. It is visible, but yeah, it's in a mode where we can actually see the next slides also and some notes also, right?
Oh, okay. Very interesting.
No issues, sir. You can continue with this, sir. You just press the next slide and you can continue, sir. No issues. Thank you,
I
sir.
think we are wasted time. I'll continue with this. Huh? Okay. Okay. I think still it's not moving at all. I need to go back. Just one sec. Is it seen now?
Still not in presentation mode, sir, but you will have to click on each of the slides to change the slide, like I believe.
Is it all right now? Can you do one thing? If you can request the next speaker if he's present, then I'll sort this out. Huh?
Fine, sir. We can do that.
Yeah. Yeah. Okay.
Thanks.
After you finish,
No
you
problem.
stop share, sir.
Yes, voice is not coming.
Sorry for the inconvenience caused. Let's move on to the next topic of today. We are going to discuss about the role of CDSS in clinical management and diagnostics. For this, we have our own Honorable Professor Subhash Chandra Parija, sir. I'll take a minute to introduce sir to all of us. Subhash Chandra Parija, sir, Honorable Vice Chancellor of Shri Balaji Vidyapeeth, is an eminent academician, erudite microbiologist, avid researcher, a keen votary of medical education, and an able administrator. He was a former director of JIPMER, Puducherry. He has authored 16 books and over 400 research papers in national and international journals. He is listed among the top 2 of the scientists globally in the field of tropical medicine. FAO and WHO expert member of foodborne parasitic diseases. Sir has also received the prestigious Dr. B.C. Roy National Award, MCI, in the year 2003 for his nodal contribution to the development of medical microbiology. Sir is the founder of Indian Academy of Tropical Parasitology, and he's also conferred with various fellowships that include FAMS, FICAI, FABM, FIMSA, etc. Thank you very much for being with us, sir. Over to you. Can I request you to please share the slides?
Let me start, then I will start. Good afternoon. Am I audible?
Very clear, sir.
Yes. Good afternoon. Esteemed Professor Lieutenant General MD Venkatesh, Vice Chancellor of Manipal University, Manipal, and my good friend, Professor Amit Banerjee, Pro Chancellor, Sikhya Anusandhan University, Bhubaneswar, and dear Dr. Vijay Kautilya, Head of Department of Forensic Medicine, the moderator of the program, and above all participants for today's webinar on clinical decision support system, a paradigm shift in health. At the outset, on my behalf and behalf of the entire fraternity of Shri Balaji Vidyapeeth, deemed to be University of Health Sciences, on my behalf again, and on behalf of our Chancellor, CM K. Rajgopalan, we extend a hearty welcome to you all for this webinar. I'm really thankful to our distinguished speaker, Professor Venkatesh and Professor Amit Banerjee, for keeping their time out for this participation in this session. Thank you so much, sir. Today, I'll be sharing my thoughts on role of clinical decision support system in clinical management and diagnostics. As Dr. Vijay Kautilya has nicely summarized, clinical decision support system is an active, dynamic, evolving system that is based on available knowledge and evidence that helps in clinical support systems. So in my next 20 to 25 minutes, I'd just like to present. First, I'll present few slides to define the STAR clinical decision support, and I'll outline the various applications of CDSS that has been taking place in clinical management of the cases. I'll illustrate that with few examples of important stakeholders who are taking part in providing the system in countries elsewhere. And then also I'll present about the value of clinical decision support system in diagnostics. And finally, I'll summarize. As we know, clinical decision support, it means it is a process for enhancing health-related decisions and actions with pertinent, organized clinical knowledge and patient information to improve the quality of health and healthcare delivery. And this is based on both computer-based systems like artificial intelligence or non-computer-based systems like conventional traditional knowledge. Computer-based clinical decision support, as it means, it involves use of the computer, ICT, to bring relevant knowledge to bear on the healthcare and well-being of a patient. We can have two broad types of clinical decision support system that includes one on expert system and second, alerts and reminders which contribute to CDS. When we think of expert system, that is based on the knowledge through artificial intelligence, machine learning skills, supported by rules of statistics, and that is extremely useful for clinical management and diagnosis of many conditions, particularly chronic diseases, and when in specifically to analyze different conditions for differential diagnosis or treatment options. Second, when we think of alerts and reminders, we think of many components. For example, system that will alert the clinicians to provide information on drug interaction checks or reminders for preventive services or certain actions, or provides a clue for clinical practice guideline integrations, means from best practices for some chronic disease patients like diabetes, hypertension, and so on. In essence, this CDSS is based on a support of a wide base of knowledge that is based on the computer-based knowledge like artificial intelligence or non-computer-based knowledge, and that serves various purposes. This CDSS, I can describe which are the three most important components. One is the sources of the knowledge. Second is the process to make it augmented or to make it more dynamic. And third, the outcome or the implication of the system. These are three important stakeholders in this clinical decision supporting system. First and foremost is the knowledge. Knowledge that provides or that gives a clue for differential diagnosis and the diagnostic methods is one knowledge based on best evidence that we are going through. And that knowledge based on best evidence harvested through artificial intelligence or different components of non-computer based learning. And this knowledge that fully covers the problem, A to Z of the problem. Now, for example, if we take the management of cerebral malaria caused by Plasmodium falciparum, this CDSS covers all the aspects of clinical presentations, diagnosis, and management. And the most important thing, this CDSS is not static. It is evolving, dynamic, and knowledge can be updated continuously. And as I told you, this knowledge is obtained or drawn from various sources. All these best or contribute to a strong storehouse of the knowledge from which data is interpreted, and his performance is validated thoroughly. The outcome of the CDSS based on this knowledge and validation of the performance contribute systematical improvements in clinical practice. Outcome is for better improvement of the patient that gives rise to less morbidity, hospital stay, or in cost containment. And obviously, this makes an attempt for the clinicians friendly to use. And here in the CDSS, decisions are always transparent. So having discussed this, let's evaluate how CDSS helps in the clinical management. What is the role of CDSS? The CDSS is nothing new. The attempt to get CDSS to play an active role in solving clinical problems and decision management, even as far as the 1950s. To quote Grains, he has mentioned a large number of computer-based clinical decision aids have been developed for usefulness evaluated over past 40 years. Many of these have involved simple type of decision support, like recognizing that laboratory test result is out of normal range, or that a medication order has no dangerous interaction with another one that patient is taking, or determining the patient is now due for a flu shot or like that. It means this computer-based knowledge was used earlier also to find out good laboratory tests that will fit for the patient, or recommend medications without any duplication of medicines with minimum dangerous interactions, or even suggesting whether it can be further in future, can be used, can be fit for taking any vaccines. So role of CDS in clinical management, even extensively used for advance in many clinical areas of clinical practice. There are many healthcare organizations which have applied the supporting system applications into disease management to control various diseases and enhance quality of care in general. And above all, effective supporting system is also critical in creating a disease management plan after a particular disease is discovered. The classical example is COVID-19. As moderator Dr. Kautilya has nicely mentioned, within a very short span of time, a lot of data has been harvested together for this COVID-19, that in future, in subsequent years, will definitely will come out with a good management plan for this type of disaster disease. And few hospitals also employ decision support software to enhance adherence to clinical guidance. This is similar to information about drugs and diseases. Hospital rules can be encoded into a knowledge-based CDSS in the forms of if, then, else pieces of informations from different aspects of informations. And such solutions perform various tasks, from prompting nurses to take specific measurement according to a protocol, to informing doctors about patients who don't follow their treatment. So these are the finer details of the clinical management which is supported by CDSS. And the most important that is gaining acceptance in the countries abroad is the appropriate use criteria. You see, all of us now have the feeling that in clinical diagnosis and management, most of the expensive supportive tests, like the imaging or laboratory diagnostic tests, are unnecessarily prescribed or not ethically prescribed. That contributes to increase cost of treatment, and also it puts a lot of financial stress on the seekers who who are requiring for the treatment. So AUC is gaining acceptance. It stands for appropriate use criteria that specify when exactly it makes sense to perform a certain medical device. In January last year, the act enacted in the US, the Protecting Access to Medical Act, obliges American hospitals to comply with insurance AUC program for advanced imaging like CT or MRI. It means that before recommending this expensive supporting system, one must be best or justified by consulting the CDS tool. They must consult a clinical decision support mechanism. Without a verdict made by CDS tool, either appropriate or maybe appropriate or inappropriate, service providers cannot receive reimbursement for their procedure. It means this brings more transparency in recommending the use of expensive medical device test or test for diagnosis that needs to be supported by AUC. So AUC initiative also expected hence to both providers, hospitals, and patients by enhancing the quality of care and reducing expenses that would have gone on prescription of the unwanted test that could have been much expensive. Hence, in essence, CDSS, clinical decision support system, is built with a matter of course intention to cut healthcare costs, that contributes to the improving patient safety, which my predecessor speaker, Professor Venkatesh, will be talking you in detail. Now I'll just give you a few examples how this has been effectively implemented or managed. For example, Siemens Health Units. They have come out with a product which supports with a range of software solutions for healthcare center, and the core decision of the support is Proteus data management system with Proteus assessment software and optional models. The Proteus data management system consolidates a patient test result from different platforms into a graphical report, which helps physicians to interpret clinical data. For example, it supports CSF testing to diagnose conditions affecting the brain or spinal cord, either infectious, non-infectious, evaluate kidney functions, assisting with early detection of renal diseases, and to assess a 10-year cardiovascular risk estimations, and even an iron and anemia assessments. So in essence, this software provides easy to understand graphical reports and suggests interpretations and recommendations, thus saving time, reducing manual work, or most important, prevent unnecessary testing and cutting treatment cost. In addition to that, they are providing artificial intelligence rat companion, which is powered by artificial intelligence to help with analyzing CT, X-ray, and MRI scans of the brain, prostate, chest, and other organs. This type of studies also has been increasingly reported from countries like ours, in which people have used software with artificial intelligence to study the X-rays of the patients suffering from pulmonary tuberculosis, actual chest, and so many clinical conditions, to have create a data bank of knowledge that will give a support system for clinical diagnosis and management. And Medical is a cloud-based clinical decision support mechanism to ensure compliance with these AUS mechanisms. Another such is Philips Healthcare. They are continuous monitoring and signaling alerts. For example, watch sepsis, infection of the blood. That gives a continuous alert, checks vital signs of a patient against sepsis criteria, and notifies caregivers when these criteria are met. And the histogram trains a model represent a patient measurement over an extended period of time. It allows a physician to see if a therapy or medications which has been given to the patient has a desired effect. Another example I can give, IBM Watson Health is an evidence-based clinical decision support system used in more than 4,500 hospitals worldwide. It integrates with all widely used EMR and CPU system. The modular structure allows hospitals to add functions gradually as and when necessary. This has many components, for example, medication management. That gives complete information on drugs given during pregnancy or drug during lactations, pinpointing potential dangers or unwanted combinations. And this also provides a model on disease and condition management that ensures quick access to treatment informations, minimizing errors, cutting treatment costs, and preventing unnecessary examinations and procedures. Sender is another system provider of CDS tool, which specifically specializes in addressing critical conditions, like monitoring sepsis, giving solution for acute kidney injury during acute conditions, or rapid response components that integrates with sepsis and AKI models to enable immediately interventions when vital signs start changing rapidly and unexpectedly. So all these few examples what we mentioned has many positive impacts on healthcare outcomes. It can help healthcare practitioners in their quest, their effort of reaching better patient care. And this system can be used at the point of care in order to help the clinicians make decisions that is correct and have a positively impact outcome of cares. Many studies have shown even the CDS can help in improving patient outcome, such as morbidity rate or length of stay, even at cost of care. So all goes for most important outcome is the quality of the patient treatment, recovery from the appropriate treatment, and another important is then the cost of care. These supporting systems are known to allow significant reduction of cost of care. This has been documented that CDSS can lower cost of care by alerting clinicians to potential duplicate testing, to minimize expensive testing, and this can be particularly successful in reducing the cost of care that often result from adverse drug events. Now, last but not the least is the CDSS in the personalized medicines, which is gaining of importance in this 21st century. Personalized medicine is an emerging area that utilizes a patient's genes, proteins, and biomarkers to determine the medical treatment and diagnosis specifically to the patient. In this situation, CDSS helps in the development of personalized medicine from research practice. And role of CDSS in personalized medicines are many. It helps to standardize representation of genomic and non-genomic patient data across health information system, centrally managed repositories of computer processable medical knowledge, and standardized approaches for applying these knowledge resources against patient data to generate and deliver patient-specific care recommendations. In addition to the clinical management, CDSS also has important role in diagnostic support. They have got a great potential to decrease medical diagnostic error and enhance quality of care in general. CDSSs for disease identification are called diagnostic decision support system or medical diagnosis system. In essence, they compare information on patient conditions with a knowledge base and generate a list of possible diagnoses. Is, for example, utilizing this deep learning for diagnostic imaging, CTS or MRI. It would traditionally focus on a specific problem areas like lung abnormalities due to infectious conditions like tuberculosis or any parasitic disease or a particular type of cancer. Similar to other CDS tools, artificial intelligence fuel programs work as second pair of eyes and make suggestions and alerts, but rather their role is to alert the clinician rather than to make a final conclusion. Again, in diagnostics, CDSS plays an important role in cost containment. These decision support tools may decrease treatment costs by suggesting cheaper, economical drug alternatives or spotting test duplications which can be avoided. And it has been shown these supporting systems save hospital units hundreds of thousands of dollars per year by alerting to the cases of excessive medical testing. To conclude, the role of CDSS in clinical management diagnostics are many. It is critical to design a useful CDSS to improve a clinician's workflow, to facilitate the clinician's workflow. And it gives a platform that provides a satisfactory system of performance and above all the outcomes, results that is acceptable in acceptable system reliabilities. Organizational factors such as leadership supports, strong clinician champions, and financial support, of course, everything contribute to play a role in the success of CDSS implement in any hospitals. To combine CDSS plus health organization benefits and money. It has a lot of benefits. Not only it provides an improved healthcare services such as capability to attract grants, it enhances quality of healthcare professionals provided by the organizations, among many other components that have been listed. In essence, CDSS is a new approach, new platform that provides a system for improved qualitative clinical management as well as in the cost of the diagnostics. Thank you. Thank you very much for your patience hearing.
Thank you very much, sir, for that very informative and effective overview of what is CDSS and what are different systems available. What we could note is very efficiently CDSS can reduce diagnostic errors and also decrease the cost of patient care by identifying adverse drug reactions and errors of medical diagnosis. You have very beautifully also brought out different systems available right now which have been effectively used. Thank you very much for that wonderful talk. Let's get back to our first session on relevance of CDSS to patient care. Eagerly waiting for Venkatesh sir to join in, please.
Yeah, thank you, Doctor. I'll just share my screen. Is my screen? Yeah, is the screen seen?
Yes, sir. So the screen is visible, yes. If possible, can you shift to the slide?
Yeah, one sec.
Presentation mode, that's all.
I'll do that. Yeah, is it done now?
Yes, sir, it's very much visible now.
Yeah, thank you. Sorry for the inconvenience and the delay. There were some technical issues. So as I mentioned when I spoke about it, my talk will cover overview on patient safety and decision support systems, functioning of the decision support system, which has already been quite elaborated by Dr. Parija. Clinical support system in clinical care and patient safety will be the focus area of my talk. Patient safety goals and relevance of decision support system and patient safety goals will be the focus of my talk. As has been mentioned, a decision support system is a system of interactive computer system that is easily accessible to and operated by non-computer specialists to assist them in planning and in decision-making functions. It provides the managers and administrators and the users the ability to receive condensed and analyze information that enhances their job performance. What began as an industry-specific application has found a very large and a big application in healthcare management systems. The decision support system, operates through a huge amount of digital data to help suggest steps for treatments, to provide clinical alerts that make difference in treatment, help identify potential problems, and improve quality of patient care. And more significantly, it helps to avoid errors or adverse events and helps the healthcare team members to be more efficient, the system to be more efficient, and the system to be more cost effective. And as it's very clear that it avoids duplication, it avoids unnecessary investigations, and also it gives alternative to, it gives cheaper alternative to the same issue. So what is the major importance? A decision support system includes any health IT system workflow or process which is intended to deliver the right information. This is about the evidence-based guidance and response to the clinical need by this patient and by the clinician. And it also gives this information to the right people, that is the entire healthcare team that includes the patient. It uses and provides the information through the right channels, that electronic healthcare system, the mobile device, or the patient portal, and in the right intervention formats in the form of order sets, flow sheets, dashboards, and patient lists, and at the right points of workflow, basically at the patient end or at the physician's end for a quick decision making or for actions at the point of care. Now, the components of the clinical decision-making system is a model management system with a user interface and a knowledge base. This has been clearly brought out by our previous speaker. And there's a flow chart which shows a system which is dependent on the knowledge base with the communication interface engine, and the clinical data. It flows both ways. But the newer system have incorporated algorithm based with the neural network with artificial intelligence powered interface engine and more applications are available through the system, and the commercial systems are available by IBM, by Cerner, by Siemens, and by Philips. The functioning of the decision support system, it completes the clinical view of the patient similar to reading data through electronic healthcare records, hospital information system, information systems of the laboratory, that is the laboratory information system, radiology information system, RIS, and the information is sharing through HL7 interfaces. So basically, it's a conglomeration or a very large database of existing system and knowledge, and it provides a very, very quick and relevant evidence-based data to all the users. Now, coming to the patient safety and patient safety goals. Patient safety is the absence of preventable harm to a patient during the process of healthcare and reduction of risk of unnecessary harm associated with healthcare to an acceptable minimum. When we mean an acceptable minimum, it refers to a collective notions of given current knowledge, resources available, and the context in which the care was delivered, weighed against the risk of non-treatment or other treatment. In the current day terms, I think patient safety takes a very, very important, in the highest priority in the healthcare management system. Now, what are the major patient safety goals when an institutionalized patient is receiving the treatment in an institution? The goal 1 is to identify patients correctly. Second, to improve effective communication. Third goal is to improve safety in high alert medications. Goal 4 is to ensure safe surgery. Goal 5, reduce the risk of healthcare associated infections, which are now a very, very important aspect with regard to hospitalized patients, especially in intensive care units or post-operative units. Reduce the risk of patient harm resulting from falls, very, very relevant in intensive care units, in neurological patients, in geriatric wards. And the falls in the hospitals often lead to a major morbidity amongst the elderly patients. Now, the goal 1, identifying the patient correctly. A clinical decision support system has got tools that are integrated into the electronic health record. It makes use of the workflows and existing data sets, and it provides effective protocols for decision making in identifying the correct patients. So therefore, the patient identification is again a major issue, and the risks of change in the identity of the patients or the samples or the results or the records is when they are maintained in a non-electronic mode is a major issue. Second is improve effective communication. This system helps the nurses, especially in phone screening of patients seeking advice, very relevant in the current day practice of telemedicine. The computerized decision software guides in triaging the healthcare personnel based on current care guidelines. So the healthcare guidelines which are prevalent for the standard of care are clearly, will clearly guide the healthcare users regarding the appropriate triage systems, ensuring healthcare personnel not to overlook critical information about the patient's health. It helps to improve the safety of high alert medications. So usually this is integrated with clinician prescription CPOE systems. And the goal is to prevent medication and prescribing errors. Some of the computerized decision-making service, suggest default values for drug doses, routes of administration, and frequency of administration. Again, the third goal is to improve safety on high alert medication. The goal is to help prevent medication and prescribing errors. This is very, very important. Some of the systems suggest default values for drugs, doses, routes of administration, offer drug safety features such as checking for drug allergies or drug-to-drug interaction. Therefore, a modern CDSS prevents both errors of commission and errors of omission, therefore preventing catastrophic events in a healthcare management system. The ensuring safe surgery, this helps in identifying the patients correctly for surgery, identifying the site correctly for surgery, identifying the correct surgery. Often we have seen that there are some surgical errors in terms of wrong procedure being carried out, wrong site being operated, wrong patient being operated. And this also, some of the new systems have integrated the WHO surgical safety checklist, which form the basis for preventing preventable errors in hospital practice. This also helps to reduce the risk of healthcare associated infections because it provides a real-time analytics alerts to the providers for diagnosis of sepsis. It also helps us to find out or detect worsening of the vital signs and also closely monitor the hospital-acquired infections and provide reminders about the best practices for treating patients with infections. Reduce the risk of patient harm resulting from falls. This is especially those who are admitted to ICUs, those who are restless, unconscious, and in post-operative situations, and those patients who are admitted to geriatric wards. So some of the advantages of decision support system is the most important advantage is in patient safety, preventing wrong identification of the patient, preventing the falls and other things in geriatric wards, identifying drug-drug allergies, drug-drug interaction, providing standard of care to the patients in terms of at the point of care, and helping decision making for the safety of the patients in the healthcare management system. This also helps the physician and other caregivers in proper clinical management with evidence-based practice of medicine. As has been pointed out earlier, big way it helps in the economics and cost containment. And it also provides diagnostic support in making the decisions regarding what is the right diagnostic tool is to be used. Also prevents over investigations and duplicate investigations, and takes over a lot of administrative functions in terms of manpower management, human resource management within the hospital system for the optimal utilization of technical and nursing manpower within the system. Some of the disadvantages of the clinical decision support systems are it works on a fragmented workflow. There are often alert fatigue amongst the healthcare workers, and inappropriate alerts often are generated because of the database which is available and also which is so sensitive to various other alerts. It also impacts on the user skills. That is also an important factor that needs to be kept in mind. Over dependence on clinical decision support system perhaps may have an adverse impact on the quality of care that is afforded by the healthcare facilities. It also hugely dependent on computer literacy, and it has got a big cost, both in the capital cost and also in revenue cost or in terms of systems maintenance, and it causes often financial challenges to the healthcare facility. It is a cost, it's a very, very cost intensive process, and therefore it's a big investment for any large the healthcare facility to indulge upon. In conclusion, clinical decision support systems have helped immensely in enhancing the quality of patient care and, more importantly, in ensuring patient safety. Clinical decision support system has some of the disadvantages of not working properly, of wasting resources, and also fatiguing healthcare providers. Extra precautions and conscientious designs must be taken while building, implementing, and maintenance of clinical decision support system. However, critical to the success is the internalization of the system and also an adaptation across all people working in a healthcare management system, in a healthcare institution. If the adoption is suboptimal, it would not function very well. Therefore, important aspect is to get the stakeholders involved at the beginning of the planning of the system, at the beginning of the implementation of the system, and there has to be a continuous training. There has to be continuous reinforcement of the user's system. Importantly, any of the new people or new health workers who are coming inside will need to get trained on the CDS system. And therefore, the critical to success after a large investment is internalization and adaptation, which is a very, very important component in reducing cost, in preventing, in taking the cause of the patient safety to the next level. And the current moment, this is a Western concept which is finding some traction amongst the Indian larger healthcare service providing groups. In our own hospital, we have developed a very small, internal, our own development, especially in our cancer care center, putting in some of these concepts into practice, and it is working satisfactorily. And only when we are sure that yes, the system is going to work, system will be internalized by the people working with it, and has a cost benefit to the patient, and also has a huge benefit to the safety of the patients, can we look at investing in a much larger quantum towards bringing in this clinical decision support system into general practice in our larger hospitals. And I once again thank Dr. Praja and this team for asking me to be part of this this venture, this webinar. And as it is, it's truly a paradigm shift in terms of implementing a clinical decision support system in any healthcare entity. So thank you very much, and Jai Hind.
Thank you very much, sir, for that very crisp and enlightening talk on relevance of CDSS. I think what clearly comes out is when right information comes to right people, to right channels and in right formats at the place of work, a lot of patient care errors and patient safety issues can be very well addressed. And that was a very nice, wonderful talk from you. Thank you very much. It was a pleasure to listen to you, sir.
Thank you.
Moving on to this, now that we have learned about what is the relevance of CDSS and what is the role CDSS plays in clinical diagnosis, and this we know is a paradigm shift, and any new thing is bound to have a lot of challenges to face. For that, I'll be moving on with our next speaker, Honorable Pro Chancellor for Shiksha Anusandhan from Bhubaneswar, Professor Amit Banerjee, sir. Uh, Amit Banerjee, sir, is an eminent cardiothoracic surgeon of international repute who has served in premier medical colleges like JIPMER in Puducherry, Maulana Azad Medical College, and associated Lok Nayak and GB Pant Hospital in New Delhi. He has superannuated as a super time senior administrative grade officer of Central Health Services, Government of India. He has been the medical superintendent of 2 teaching hospitals and a super specialty hospital. And he has been rewarded as a distinguished alumnus of Maulana Azad Medical College. He is also the recipient of the prestigious BC Roy National Award, Delhi Government State Award, Indira Gandhi Excellence Award, in addition to several other awards, orations, and international fellowships. Sir has authored nearly 150 scientific papers, invited chapters, and books. He has also served as a Vice Chancellor for the West Bengal University of Health Sciences from 2011 to 2014. So it's an honor to have you. Can we request you to please share your slides?
Am I audible now?
Sir, you're audible. Yes.
Okay, okay. Thank you. And let me start with sharing my screen. Okay. Is the movement?
Yes, sir. Slides are visible and they're changing.
Have I been able to move my change my slides? Okay.
Yes, sir. Yes, yes.
Okay. It's a bit informally formal, but now at the outset, let me extend my heartfelt gratitude to my very old friend, and in fact, in many ways, I consider him as one of my mentors in many disciplines, academic and extracurricular also, Professor Subhash Parija. It was such a pleasure to listen to Lieutenant General Venkatesh, sir. It was such an enlightening talk. And of course, I think the cherry on top of the icing on the cake is the smile of Professor Kautilya. Thank you very much. You have made my day today with your smile. So I've been given the task of discussing with you the challenges in the implementation of CDSS. And Major General Venkatesh has been kind enough to touch upon it quite a bit. So he has made my job a bit easier. So what I'll do is I'll do it in a little, informal way, or rather unconventional way. And I'd like to, first of all, give a reply to Dr. Joseph Philip Raj. He asked a very interesting question. He says, please opine on the statement, CDSS undermines the physician's intellectual capacity. So, let me try to answer this question with a rhetoric. This is a very important question. It's a very relevant question. It definitely, many of the reluctant physicians and the physicians, as Professor Kautilya pointed out, who are extremely passionate about their own profession, say that they do not need this kind of help in looking after patients. But then to give a kind of analogy to this, We have got these BrahMos missiles, and we have got the computerized, target-oriented missiles every week or so. From Sriharikota or from some other space centers, India is trying out these missiles, and they're all. We have got a army person in our midst, so he'll probably bear me out. All these missiles are meant to go on the basis of their computerized functioning and hit a target as required and as programmed and as ordered. So does it mean that once these missiles are there, the Bharat ka jo fauj hai, they will run out of sharpshooters, Will they lose their sharp shooting capabilities? Will they say, चलो हमारा तो मिसाइल computerized है, हमारा LMG जो है वो computerized है, हम जो रॉकेट लॉन्चर है वो computerized है, तो अपने को sharp shooting की जरूरत नहीं है. So will they stop their target practice? Will it undermine their target practicing capabilities? No. So this is the only analogy I can give to Dr. Joseph Philip Raj question, but at the same time I must admit and I must definitely acknowledge that it's a very, very pertinent question, and definitely a question which is not very easy to answer with a 2 + 2 = 4 kind of a thing. So now before we talk about the challenges, let us see what are the current strengths of the reliability of CDSs. As we have already said, it has not only brought out a paradigm shift, it is the kind of tangential outcome of a quantum leap in virtual applications of science and technology. Professor Parija was very right in pointing out that CDSS is not something new to us, something that we have been actually practicing or actually experiencing since the 1950s. But in the form that it has come today is way ahead of what we have conceived it as in those days. And why has it and how has it happened? It has happened because of infinitely enhanced computational capabilities due to what we talk about Industry 4.0 or the fourth industrial revolution, which has come just a couple of years back. And the fourth industrial revolution is a way of describing the blurring of boundaries between the physical, digital, and biological worlds, incorporating a fusion of advances. So it is because of the advent of the fourth industrial revolution that we have now very confidently launched on introducing CDSs as part of our professional life. To make certain things easier for us, to make certain things more confident for us. So let us see what are the components of the fourth industrial revolution. Apart from cloud computing, we have got artificial intelligence, robotics, Internet of Things, 3D printing, genetic engineering, quantum computing, deep learning, data mining, and other technologies. These tools provide the data and knowledge needed, but they do not help to apply that information to a particular patient-related decision or a task as such. So, they have to be designed to sort out through large amounts of data and provide the clinicians through actionable insights. So, once this data has been computed in the appropriate manner with the appropriate goal, these tools can suggest the next steps of treatment, detect potential but rare problems, alert care providers to problems, information they might have overlooked, and supplement diagnostic options. And the only thing is that these changes are so profound that the founder and executive chairman of the World Economic Forum had once said, these changes are so profound that from the perspective of human history, there has never been a time of greater promise or potential peril. So all these perils of new technology constitute the challenges in the effective implementation of CDSs. Now, these challenges, I have tried to broadly divide them into, 3 heads: the clinical challenges, and I'll follow with the programming challenges and the human challenges. So when you talk of the clinical challenges, The first important thing is that no clinical database stores all information that is self-sufficient or complete. And any clinical database will have its own variations, geographical variations, regional variations, or, continental variations. So, therefore, to tailor one particular CDSS which will be applicable to the entire human race becomes a little problematic. Computers can assist but cannot replace the human resources, and therefore a CDSS system which has been brought out, which has been developed, can only be as good as the people who have put their heart and soul behind it, and the strengths and the weaknesses will all depend on that. The components of CDSS, unless they're properly integrated, constitute one of the challenges, because unless all the components, as Professor Parija has exemplified in many ways, unless all the data and all the requirements and all the offshoots and all the required targets are integrated together, a CDSS system will not be a complete success. Then deficiency in planning for how the clinician is going to actually use the product in a given situation, because the people who are developing the CDSs, they are not necessarily healthcare personnel alone, but they are healthcare personnel who are grossly assisted by the technologists and technicians who pick out the artificial intelligence or data mining and other things from the fourth industrial revolution, and then they kind of, tailor them, customize them towards the requirement of the healthcare professionals. But how the end user is going to use it remains a doubt. And CDSs, those are the ones aimed at diagnostic tasks, have found successes, but there are many instances where there have been limitations of scope and utilizations. So what are the programming challenges? Programming challenges are difficulty in incorporating the extensive quantity of clinical research that is being published on an ongoing basis, and the difficulty of constant updation of the data, which is mandatory in healthcare. Suppose in the month of February 2021, a CDSS system is there on a of healthcare. Then by March end or by April, it may actually become relatively outdated because of the further data that is accumulating in that area. And is it possible to update a CDSS system in, kind of on an online basis? It still remains a question. As of now, that is not feasible. As of now, to update it, the entire thing has to be reconstituted and data has to be reanalyzed. So this remains one of the challenges. This remains a challenge because, eventually it is not the computerized system, or it is not the computerized program which is going to assist the clinicians. It is ultimately going to be the biological system, which is very complicated and actually which if it is required to assist in clinical scenario, requires enormous amount of fail-safe data. So these CDSs, therefore, work on the basis of three parts: the knowledge base, the interface engine, and the mechanism to communicate. Interface engine is something that we may be confident about, provided we have got somebody who is a knowledgeable person, who is technically savvy in creating this. But the knowledge base will always remain a question mark, because the knowledge base can never be supplied or can never be obtained in its entirety. So that may remain a challenge for some time, unless we are able to find a way by which this knowledge base can be actually customized for individuals or institutions or regions or hospitals and things like that. And of course, the last thing is the mechanism to communicate. The communication of this CDSS system, it is going to be two-way communication. It may communicate something to the clinician, but how the clinician is going to interpret it on the basis of his own knowledge remains again a challenge. Now, then, everybody is talking of the artificial intelligence, and, all computer scientists are extremely geared up to use artificial intelligence, and they all want that more and more of this should be put to use. But, here we are dealing with human beings. So incremental use of artificial intelligence and machine learning and data mining, which are the two important components of CDSs in healthcare, it may prompt the researchers and the provider organizations to freely and at times recklessly apply these technologies to clinical decision supporting tools. So, if we know how we are going to apply the artificial intelligence, unless we are very, very confident that what we are doing is based on logic, is based on evidence, is based on safety, if we simply recklessly apply this to CDSs, that may remain a very big challenge for the outcome of the CDSs as a tool of application. But combining these systems with advanced analytics itself, there may be certain mismatches, there may be mismatch of minds, there may be mismatch of data, there may be mismatch of technology. So eventually these themselves may introduce their own set of challenges. Then as I said, the blind application of machine learning and data analytics, particularly in the sphere of image analysis or radiological, pathological, or microbiological conclusions, may lead to serious danger in the diagnostics and therapeutics unless the clinician is sensitized to have his overriding role. He should have a overriding role in the decision making. He should not be completely dependent on the CDSS system. To cite as an example, recently for the last couple of years at Shiksha Anusandhan, we have been working with Intel to create this kind of system for certain malignant lesions, for example, solitary lung nodule and certain other things. And as we are going on feeding more and more data, every time we feed more data, end of every 3 months when we analyze, we find that there have been certain shortcomings, because the more data you put, the more question marks need to be answered, and the more and more complex the whole thing becomes. So these complexities can never be solved 100%, but they all need to be kept in mind. And that is why eventually, to answer Dr. Joseph Philip Raj, eventually it is the physician's own acumen, his knowledge, his wisdom, the application of the knowledge and wisdom, his common sense, and his ability to eventually apply his clinical acumen to a particular scenario, overriding what the CDSS is guiding him or asking him to do, is eventually going to be what is to be considered as the most appropriate and safest for the patient. So I think CDSS certainly at this point of time is not here to undermine the physician's intellectual capacity, Dr. Philip Raj. So as we move on, then after these challenges, we have the administrative and human challenges. There are different CDSs which serve for different purposes. So, there is no common method which applies all such systems. Then there are people whose CDSs is developed only on the basis of artificial intelligence and, data mining. On the other hand, there are CDSs systems which are based on analysis of available data in a particular institutional setup, or analysis of available data in a region. And the biggest challenge here is that on account of personal privacy that needs to be maintained, on account of confidentiality that needs to be maintained, a huge amount of data which would actually have appropriately contributed to the success of a particular CDSS system may not be available to the researcher, because the huge amount of data that we generate from the patients in the Western world, they may not actually be available to those who are developing a CDSS system. So this is a very big challenge. Then there are the human challenges. We may, as Professor Kautilya pointed out, physicians can be very passionate about their profession. So, there may be very sub-motivated physicians. There may be reluctant physicians. old people like me, they can be non-computer savvy, and we may actually make a mess of the interpretation. Or the end users may be non-meticulous. For example, while the CDSS has given just some of the indications, they may extrapolate it to their requirement, and they may miss out on certain things, like like what happened in the DRS decision. The third umpire saw only half of the scene and then gave his decision and did not see the entire thing, and as a result of that, a wrong decision came up. So this kind of things will happen due to human challenges. Then there will be variations in the conceptual uniformity between private and institutional variations. For example, we may treat patients in our own institution, and then we may ask the patient to get a follow-up done at his with his personal physician, or at the district level, or at the village level, or the primary healthcare level. So certain things that have emanated out of the CDSS at the institutional platform may not appropriately reflect, or may not be appropriately appreciated by the private practitioner, and therefore there may be some degree of conceptual ununiformity, conceptual disuniformity, and eventually it may be the patient who is the sufferer. Then there are quality issues of, as I said, that the CDSS, which is developed by a well-known market group, may have a different kind of a acceptability, and may have a different kind of accuracy as compared to that developed by startups or others. But it is here where the question of investment comes, because eventually the one developed by the startup, though it may be subject to its accuracy, subject to its quality, it may be actually much more economical to afford. And so the investment versus, or investment vis-a-vis the quality, may be a very big challenge. Then there are again the human challenges of the changing relation between the patient and the physician. The Indian doctors in the United States of America, I have got nearly 60, 65 classmates who work there. They say the difference between the Indian doctor and the doctors from the other countries, particularly USA or other countries, is that they say ki Indian doctor he talks to us, he explains to us, and the other doctors, they only show us the computer. So this changing relationship is going to be very, very important, because once the doctor is confident of using the CDSS, I think the personal doctor-patient relationship is going to take a backseat. This is a challenge. Then again, for certain individuals who become very, very obsessively dependent on the CDSS, it may limit the professional's possibilities of independent problem solving. And then, of course, comes another query which has been raised by Dr. Joseph Philip Raj. He has asked, what about the legal implications? So, the legal implications is going to be a very big question mark. As you know that there are certain Indian courts where the telltale video evidence is not accepted as evidence. The dying declaration, unless in the presence of a magistrate. Sorry, Professor Kautilya, I am coming into your domain. But what we were taught was that for a dying declaration, a magistrate has to be present. I think certain things have now changed. But if there's a dying declaration which is video recorded, the court will not give it importance, but the court will rather give importance to a dying declaration which has actually been recorded in black and white and has been countersigned by the authorities. So, these legal implications are definitely going to come. And, if there is an issue with the patient's treatment, if there is a negative impact of using the CDSS, if the patient has loss of life or limb, then certainly we cannot, at this point of time, we cannot blame the CDSS for what has gone wrong. The blame will probably squarely come on the physician or the clinician. So the legal implications are a very, very dicey area. Thank you, Dr. Joseph, for pointing out. And this is something that is going to be a very big challenge for the future. And then, of course, as Lieutenant General Venkatesh has pointed out, if a poorly designed or implemented clinical decision support system is brought into effect, then there can be alarm fatigue. A high number of false alarms can lead to alarm fatigue. Alarm fatigue is it is a sensory overload when clinicians are exposed to excessive number of false alarms. And this can result in, desensitization of the alarms. We may just override the alarm. We may just switch it off, and then like the Aesop's fable story, when a boy says a wolf is coming, a wolf is coming. Eventually, once we have desensitized the system, when the actual wolf comes, we may not be able to rise to the occasion. We may miss an alarm. So these are some of the problems. And actually, there are instances where patient deaths have been attributed to alarm fatigue. Then there is something called physician burnout, which is a state of emotional, physical, and mental exhaustion caused by excessive and prolonged stress of, depending on a particular system. It occurs when you feel overwhelmed, emotionally drained, unable to meet the constant demands. So burnout affects not only the health of clinicians, but when the health of the clinicians is affected, automatically it affects the health of the patient and the healthcare system overall. So it is believed by some that, if CDSS comes in a big way, this could be one of the factors that needs to be accepted as a challenge and needs to be tackled on war footing. And it has been found that when some of the clinicians, when they experience this burnout, there may be risks of depression, substance abuse, occupational injury, or even suicide. So what is very important to kind of squarely meet the challenges, to increase the user acceptance by motivation, training, education of the clinical and non-clinical staff for using the system, and particularly those who are apprehensive, their apprehension needs to be allayed that their professional acumen, their professional training, and their professional importance is certainly not going to be kind of stolen away by the CDSs. Then we must use better user interfaces. This could be done by involving the user at a design stage itself, so that we do not thrust a CDSS on somebody, but we actually involve him in the designing process. And eventually we get a product which he is able to apply with as far as his needs and desires are concerned. There's something like the farmers' law. I'm not going to enter into any politics, but one of the factors the farmers claimed was that they were not involved. They were not even discussed about when these laws were brought up. So the same kind of an analogy can be used here. Convenience at the end user should be kept in mind at the designing stage itself. We should not create a very advanced, a very accurate product which the end user is unable to use to his advantage. And the other constraints need to be identified on an institutional basis, on a localized basis, regional basis. And of course, finally, the cost utility analysis is very important. And to conclude, as a group of researchers have rightly pointed out, a lack of user testing and iterative design is more likely to lead to unintended consequences and an error-prone system, and these must be addressed in accordance with the growing body of literature on this topic. It is imperative that we approach the study of CDSS with the same rigor with which we approach the more traditional healthcare interventions. So I think very briefly, very important message has been given that CDSS is something that needs to be, whatever happens, it needs to be a system which will only assist us, which will only guide us, but eventually when it comes to any controversial area, or when it comes to taking specific decisions for the patient or for the beneficiary, we need to apply our mind. We need to apply our, as I said, knowledge, wisdom, and common sense to ensure that the patient is not the victim of the of the challenges of the CDSS system. Thank you very much. And with that, I have just listed some additional resources and references which can be referred to. I am grateful to the university, to Professor Parija, and to everybody else of SBV for this opportunity. And let me acknowledge that, whatever we have discussed is entirely open to criticism, is entirely open to further fine tuning, because this is not, I am not a subject specialist, but I have kind of tried to, figure out what are the things that could go wrong. And this also will remain, the challenges of CDSS will remain an ongoing topic. And the last word has not been said today. Thank you very much once again.
Thank you very much, sir, for that scintillating presentation. And personally, I feel that was a great analogy you began with in the beginning. I feel the golden words for the challenges that I can take from your presentation would be data, right? I think the biggest challenge we have with implementing CDSS would be how we handle the data that we have and how we make it more user-friendly and user-acceptable nature. So thank you very much for that excellent presentation, sir, and also for the compliment. If you have any questions, maybe you guys can put up the questions in the chat, and we're already off time. So I think any more questions, if there are there to be answered, we can take that, or maybe I can collect the questions and share the questions with all the speakers so that we can get back to you later again. That was truly a wonderful session we had, especially with the three great stalwarts whom we could listen to today. Thank you very much, sir. I think all of you will agree with me that we have significantly grown in our knowledge on what CDSS is and how it can be effectively implemented.
Vijay, can I ask a question?
Yes, sir. Joseph, sir, please.
Yeah. Good evening, sir. Dr. Amit Banerjee. I hope you remember me. I was the MC for
I have already answered. Yes, boss, I have written.
Oh, okay, sir. You're trying to. Now, one of the other question I had asked is if any complication or morbidity increases after following CDSS to the book, are we legally protected? What is the legal implication of using CDSS?
Can I answer that question, please?
So please go ahead.
Yeah. As I said that as of at this point of time, we have absolutely no legal protection as far as the application of CDSS is concerned. And that is why I said that eventually, for the sake of the patient, for the sake of the healthcare community, for the sake of our own institutions, we have to understand that at best CDSS is an assisting system. It is not a system by virtue of which a physician can treat his patient. When it comes to taking a decision and doing what is the most appropriate for the patient, it is the physician who has to apply his mind, who has to apply his knowledge. And the only thing that CDSS does in certain scenarios, it is twofold. One is that it cuts across lot of formalities, cuts across lot of let us say exposure to radiation. When one CT scan is not giving the right detail, then we tell the person that you go take this view, that view, this kind of a thing. So some of these things are done away with it. And secondly, in certain areas, where we find that, as I said, solitary pulmonary nodule is the best example. It may be located at such a point that it is not possible to do a fine needle aspiration by virtue of the anatomical location. And it may be a young unmarried girl on whom we may not like to do surgery just to take a biopsy. In such a situation, if we have a CDSS system which has analyzed thousands and thousands of this kind of pulmonary nodules and is able to give us some kind of a pinpoint, some kind of a guideline as to what are the things we need to think of, it can be of a great assistance. So this is just one example. Similarly, image Image matching is one of the biggest advantages of CDSS system, and we know that people have been using it for pathological image matching, for microbiological image matching. But eventually, to be legally protected, we cannot blame the CDSS for anything. As of now, the legal responsibility is entirely of the clinician and the institution. So, Dr. Joseph, have I answered you right?
Yes, sir. Fine. So it's
Thank
still
you.
on the thing, not yet approved as far as the legal problems are concerned.
Yes, that's true.
Thank you very much, Amit sir. I think, as you said, the decision is still the clinicians, right? It is just a support system that helps the clinician to
Yes.
take a decision. So the
Yes.
clinician would logically be still be liable for that. Thank you very much for that, sir. If there are no more questions, I think, like all good things come to an end. I think we are reaching the end of a very wonderful and very academic session that we had, and I would like to propose a small vote of thanks. I would like to first extend thanks or appreciation to our Honorable Chancellor, Mr. M.K. Rajgopalan sir, for providing us a platform to kind of keep working and do good for the society. I'd also like to thank our Honorable Vice Chancellor, Dr. Subhash Chandra Pajia sir, for being a constant source of support and motivation for all of us. And most importantly, I would like to extend my gratitude and heartfelt thanks to all our resource persons, Lieutenant General Dr. M.D. Venkatesh sir and Professor Amit Banerjee sir for being with us and taking all the pains to enlighten us on this topic of clinical decision support system. Thank you very much, sir. Today's day was all possible because of you guys. I'd like to also thank the whole team of SBV and SBV Connect for doing a wonderful job to organize and also giving me an opportunity to be the moderator for today. And all the IT staff and last but not the least, all the participants for patiently keeping up with us and joining us. Participants, please note, our next session will be held again on 17th March. That is the third Wednesday of next month. And we'll be talking to you about COVID vaccinations. So please do tune in to us. We'd like to hear from you. And if you have any queries or any suggestions for future topics, please do mail us in the mail ID given to you along with the registrations. Thank you one and all. Thank you everyone.